So the research project that I want to talk with you about today is a project that we're undertaking with the support of the Mack Center here at Penn. And this research examines a phenomenon which is literally sweeping the country in the world of healthcare. Innovation is all the buzz in the world of healthcare these days. And what we're finding is that a number of hospitals, academic medical centers in particular, have created a new role in their organization, and that role is called Chief Innovation Officer. Sometimes it's called Vice President for Innovation. But the person who occupies this role is tasked with trying to develop new approaches, new solutions, innovative ideas, and drive them through the organization. What we're interested in the project is trying to understand, number one, why hospitals are investing in the creation of this new role and perhaps the structure of the center. Number two, who are the people who are being called on to head up these initiatives? And number three, what are the outcomes? Are rates of innovation in any way affected by the creation of this role, and how? So this research, we're on the sort of the front end of the process here. We're interviewing chief innovation officers and other people sort of around the country in academic medical centers. And we're probably halfway down the road in terms of the data collection process. And I'd be happy to share some of the findings with you at some point during this conversation we're having. Well, the thing I love about this project is it sort of fits right foursquare in the center of the Mack Center's mandate. And the Mack Center's mandate and the research itself, the goals of the research, are to contribute in two dimensions. One is the development of and further refinement of theories of innovation in the context of large, complex organizations. And number two is, so what are some of the practical applications of the research that we do? So we're not undertaking this research simply to advance theory, but we're also very, very interested in the practical side of this. So what seems to be working in what contexts? What can we learn about the way in which it's working or the kind of obstacles that organizations doing this encounter that we can then disseminate and let others learn from, so that the process of the development of innovation, of new approaches in these complex, wildly complex academic medical centers can unfold with fewer problems and perhaps better outcomes. So what's really interesting about this is that while everybody agrees that the current dilemmas that our healthcare system is facing require innovation, and innovation, everybody's talking about innovation, these centers for innovation are slow, a little diffusing somewhat slowly themselves. And what we found, there are two things that are important at this point. One is the question of, so who's getting picked to play the role of Chief Innovation Officer? And what we find there is that sometimes the candidates are internal people, the people who are chosen are internal people, physicians who understand the institution and its culture well. And in other cases, they're outsiders who don't have an MD degree, but who've been very successful in moving the needle on innovation in other settings outside the world of healthcare. That's interesting because there are two quite different theories about the capabilities that are required to be successful. The second thing that we're learning is that implementation is the stumbling block. While it's easy to get one of these things off the ground and to hire somebody, it's at that point that the real hard work begins. And what we're finding is that in some cases, there's been a certain amount of success in moving the needle on innovation. In other cases, it's been a really tough slog, and implementation is proving to be a huge challenge. So what's really, one of the things that's been really interesting about this is to see how innovation is defined in different settings that we've observed. And what we're finding is that in some settings, it's relatively narrowly defined, perhaps in terms that most of us might sort of off the top of our heads associate with an academic medical center. There are innovations in medical technology or innovations in surgical procedures. But in some settings, the definition of innovation is much broader and includes innovations in human resource practices, innovations in the way workflows are defined, and it's sort of a much broader view. And one of the things that we're interested in, and we think we are onto something here, is it seems that when somebody is hired from the outside to play this role of Chief Innovation Officer, and when I say outside, I mean not only outside the academic medical center itself, but outside the field of medicine in general, they tend to take a much broader view of what innovation encompasses. So the range of initiatives that are undertaken under their aegis is somewhat broader than the range of things that are undertaken, initiatives that are undertaken, when it's an MD who is in this role of Chief Innovation Officer. That has, I think, real implications down the road for how institutions that haven't already set up an innovation center, haven't identified and hired a Chief Innovation Officer, might want to think about what they want to accomplish with this role, because the kind of person you choose for that role is going to have a major impact on how innovation gets defined internally and then what the consequences are subsequently. So what's next? Well, I'm working with Kyle Myers, who's an advanced doctoral student in our department here at Wharton of Health Management Economics, and 3 undergraduates in the engineering school on the work in healthcare. That work, we're in the process of finishing up the data collection, and that should be completed rather soon. One of the fun things about this project is that as we've gotten into it, what we found is that this role of Chief Innovation Officer exists in other sectors of the economy outside healthcare. And it's going to be very, very interesting in terms of what's next to see whether the kinds of things that we're finding in the world of healthcare also apply to similar kinds of initiatives outside the world of healthcare. My suspicion at this point is that there will be some crossover, and so some of what we're learning about more and less effective initiatives in the world of healthcare will be relevant for organizations that are anticipating adding this position of Chief Innovation Officer outside the world of healthcare. So we're very excited in a practical sense about the implications of our findings in the world of healthcare to the world outside healthcare.